Hello, everyone. My name is Matt Fielding, and I just want to take a few minutes of your time to talk to you guys about proper prescription drug use. This is just kind of a generalized presentation that we're going to go over general guidelines and safety, and then we'll look a little bit more specifically into opioids because that's a really hot topic, as well as antibiotics, just because that's a kind of a misunderstood topic. So just in general, it's a really good practice to know what you are taking. You would be surprised by how many people do not know their list of medications, and it's kind of dangerous to just be taking medication blindly just because your doctor tells you to. So you want to know what you are taking, and it's a really good idea actually to know what you are taking it for. This helps you be on the lookout for different side effects, or also recognizing different interactions that might occur. If you have a question on this, the pharmacist is a really great resource, especially when you first get a new prescription from your doctor, to ask, those kind of questions. Well, will this interact with, my other medications that I'm taking? What do I need to be on the lookout for? What should I report to my doctor? Those are really good questions to ask. You want to follow prescription directions exactly as they are given. There will be directions given on what to do if you miss a dose, if you should take another, if you should just wait until the next scheduled time, or if you should take it immediately when you remember. That will just depend on the medication, and there will be specific directions for that. Sometimes medications have directions on how to take them, if you need to take them with food, with a full glass of water, if you need to lay down or stay up. There are very specific directions on specific medications that you want to watch out for. Another thing you want to watch is, for example, if you take a medication for blood pressure every day, you want to be watching that blood pressure every single day. You want to take it at the same time, routinely, so that you can have a nice trend to look at, and you want to see what that medication is doing for your blood pressure and seeing if it's being properly managed. Just proper storage. You want to keep your medications up in a locked cabinet. We'll talk a little bit more about this when we talk about opioids as well, because those ones are a little bit more dangerous, potentially. But just a good storage practice is to keep them separate away from, food and other things, in their own designated cabinet that is high, far up away, and lockable. And some important do nots with just medications in general. Do not share your prescriptions with others. Do not take your medication past the expiration date that's listed on the bottle. Take more or less than the prescribed amount. If you're trying to treat a certain symptom, taking more is not appropriate. If you're having unrelieved symptoms, it's best to talk to your doctor, and they'll decide if they should do a dosage adjustment or look at maybe an alternative medication or a different option. And then you do not want to keep old prescriptions if they are discontinued. So if your doctor starts you on a new prescription, you want to get rid of that other one. And there are proper ways to get rid of it. There are, you can mix it up with coffee grounds, and that will destroy the medication. You can also take it to safe disposal locations, such as I think most fire stations can accept them. There's a list that nationally of sites that can accept medications to properly dispose of them. Talking a little bit about opioids, you've been prescribed these for moderate to severe pain. Sometimes it's short-term use, like after a surgery. Sometimes it's chronic, like with back pain, under direction of a doctor. The thing to be aware of with this is that opioids can be addictive, and so as a general guideline, you want to take it for the shortest time possible, and just enough to manage your pain appropriately. So follow the doctor's directions. It also helps to use something else in addition to the opioid medication, such as relaxation, icing, other non-medical ways to help with that pain. We talked about the storage of medication, and then you want to destroy any unused portion. So you don't want to save it for later or sell it to somebody else or share it with another person or take it longer than prescribed. Just some general information about antibiotics. You've been prescribed antibiotics to treat infection in the body. So you do want to take this exactly as it has been prescribed for the amount of time or the specific amount of doses. Many people do not take antibiotics appropriately in this way. They'll take it only until they're feeling better, and then they'll save the rest of it for later just in case they start to feel sick again. And there's a whole slew of problems that can be created with those types of practices, including, creating superbugs and getting super infections. And so it is best to take the medication for the specified amount of time and the specified amount of pills. Most of the time it's the complete prescription until it's gone. And then, of course, you just want to be watching out for any sort of reactions, allergies, reporting those to your doctor. So just to recap as a general, just as we've gone through this, you want to know your medications. This helps you to be familiar with possible side effects and interactions. Know what you need to be watching, such as blood pressure or heart rate. It's important to follow prescriptions instructions exactly with regards to how to take it, the time, and then you want to store them safely, dispose of old medications appropriately, ask questions if you don't know. The pharmacist is a great resource. The doctor can also help. Nurses are a good resource. And then do not share or sell prescriptions. And that is it. Thank you.